Minister for Health in Fiji, anything to do with health is something that interests me. I've just been at another private clinic, and I believe that the way forward for building a healthier Fiji is to work with as many other partners as possible. That's why I'm very thankful for the Fiji Cancer Society and what they've been doing for a long time. I'm thankful for organizations like WOWS and other organizations that have taken it upon themselves to do something about helping to improve the lives of our people. Must forgive me if my voice is a bit not feeling too well today. I'm also very thankful for organizations like the Ready Group, the Tanoa Group, for what they are doing in helping to promote and help us in dealing with things related to health. I'm not a cancer expert. I'm not a medical expert. Everywhere I go, last week I was chairing a Pacific Health Ministers meeting. The first thing I told them is that I'm not a medical person, but I have a lot of medical people around me who can tell me about these things. Some of the statistics that I've been told, that I was given today, is showing that there's quite a lot of children around the world, less than 25, 15 years, who are developing cancer, different types of cancer. They've given me the rates here. And I've noticed also the stats that they have for Fiji. They're estimating a number of cancer cases around 45, according to this, but we are only seeing half of them. So we need the other half to be brought up so that we can deal with them. Listening to what Raj was talking about, I can see that one of the problems that we have is having an early warning system so that we know where the potential problems are. And I think that's going to be the effect of this campaign. So that together you'll have a number of tools. Together you can work on identifying where the potential problems are, who are the potential patients that might have cancer, so that work can be done to try to address their problems. So that is something that is very noble and something that is that we should all get involved with. Dealing with cancer is something that's important with our ministry, oncology, developing the different people, developing our own resources, to make sure that we can improve our ability to help you, the mothers of patients, the fathers of patients, so we deal with their issues. And that's something we hope to continue to do over the next few years, over the period. Looking at the notes that has been given to me, one of the things that has been highlighted is the ineffectiveness of our prevention and screening so far. So hopefully this awareness program to be something that will try to address that and to improve that, and so that we can work together to help our children become cured, that we can identify who they are so that the services can be provided for them. I'm not going to speak for too long, as I said, as I'm not an expert. I'm really grateful to be here. I think this awareness month, for its success, depends on the activities of a whole range of people. I can tell you that within my ministry, we will provide our support through our health centers and other places where we can propagate the messages and make use of all of these things that we have here, together with the early warning signs, so we can try to get as many people involved in the program. I look forward at the end of this month to receiving a report that tells me how well we've managed to raise awareness. I understand this program should have a number of very clear targets that it wants to achieve. At the end of the day, what we're shooting for, what we're hoping for, is to improve the health of our people. Over the past 20 years, from 1995 to 2015, we have noticed that most of our health indicators around the Pacific and in Fiji have been improving over the past few years. But you know what? The rest of the world is improving faster than us. So that's a major challenge for us. I'm hoping that more such programs like this, more collaborations between the Ministry of Health and other partners and other organizations as represented in this particular exercise will help us to accelerate the rate at which we address all of our problems, so that together we can finally move closer to that vision that we have in the Ministry of Health, which is to have a healthier population in Fiji. I wish you all the very best during this Children Cancer Awareness Month, and let's all make an effort for all of us not to just walk away from today's program and forget about it, but actually all of us to take the task of trying to raise this awareness to at least 10 or 20 or 30 people so it can have an impact. They say in the book, the holy book that I go to, nothing changes the world than a small group of dedicated people who have the aim to change the world. When that happens, when you have that, then we can move mountains and we can create a great difference. So I wish this campaign of cancer awareness all success, and I look forward to your support and your collaboration and your active effort to make it happen. Thank you, and I open this month so that we can go ahead and make a difference in the lives of our children.